Hello and a very warm welcome to this webinar with Bayer on sexual and reproductive health in times of crisis. My name is Zahid Torres-Rahman and I am the founder and CEO of Business Fights Poverty, a business-led social impact network, and I am very privileged to be your moderator for today. In just a moment, I'm going to introduce our excellent panel who are going to lead us through a discussion on access to sexual and reproductive health care, which we know is absolutely critical to women's economic empowerment, to women's safety, and also to fighting poverty. When women and girls are able to plan, or rather when they're not able to plan for their own future, when they don't have access to healthcare services and to information, then they miss out, they lose out on opportunities for education, for jobs, and also they face greater healthcare challenges. One big factor, one powerful fact I came across before this session is that globally, basically health care issues related to sexual and reproductive diseases and conditions and pathogens account for 1/5 of the global disease burden, and also for women or reproductive age, 1/3 of the disease burden for those people. Of course, all of this drives gender inequality and it impacts the most vulnerable the most. Now, many of you will be aware that it was World Population Day recently, and these issues surfaced again as part of that discussion. Of course, all of us as well are living through multiple crises, not least most recently COVID. And these crises have really driven up the issues faced by women and girls, aggravated those issues, and in many ways puts at risk perhaps even the attention span, the risk that we're being diverted in a sense from the attention that's needed on these issues. So a big question around how do we keep people focused and raise the finance that's needed to support women and girls, especially in low market and middle income countries. So today we're joined by an excellent panel of experts to really dig through some of these issues, to understand what the future holds for women and girls, what that situation is now and what we need to do about it. So without further ado, I'm going to introduce our panel we've got today. First of all, Claus Runge, who's the head of market access, public affairs and sustainability at Bayer Pharmaceuticals. Welcome, Claus. Mariarosa Cutillo, who is the Chief of Strategic Partnerships at the United Nations Population Fund, and also Margo Warren, who's Head of Policy at the Access to Medicine Foundation. Welcome to all of you. And to all of you who are tuning in, please do introduce yourself in the chat. Let us know where you're dialing in from. We'd love to hear from you as well. Please also, as we go through the session, please post your questions to the panel and we will come to those as we go through. So let's kick things off and set the context. I'd like to ask our panel, maybe in just a couple of minutes each, introduce yourself and tell us perhaps one key message to this opening question. When we talk about a crisis, what should the audience know about the pressing issues that girls and women in low and middle income countries are facing right now? Perhaps we could start with you, Mariarosa.
Thank you, Zahid, and thank you very much. Thanks to our partners from Bayer for organizing this. It's always a pleasure. Maybe let me put this in perspective, Zahid. On the 11th of July, UNFPA has announced the Population Day statement. And what we're saying is that November, towards a certain date, the world will reach 8 billion. And as our executive director, Dr. Natalia Kanem says, and I'm reading a piece of her statement, people are the solution and not the problem. So how are we going to arrive to that date if we don't speak about the potential of women empowerment, of the fact that sexual and reproductive rights are human rights that need to be recognized? So what we think at UNFPA is that, and to come back to your point, one point I want to make, if we don't recognize these as fully human rights, it will be difficult to talk about a society that goes towards the 8 billion, which is fair and equal for everyone, starting with women and girls. So I would like to say that that's my initial statement. I'm Mariarosa Cutillo. I'm the Chief of Partnerships at the United Nations Population Fund, which is the UN agency leading on sexual and reproductive rights. And the work that I do every day, and I'm proud to do, is building partnerships, an ecosystem of partners, particularly with private strategic partners. And Bayer is one of our key priority partners in our journey on ensuring access to sexual and reproductive rights for all. Thank you.
Thank you, Mariarosa. Margo, perhaps I could come to you next.
Thank you. And also wanted to say thanks again for having me and for highlighting this important topic. I think it's a really good moment to be speaking about this. So I am Margo Warren. I'm the head of policy at the Access to Medicine Foundation. In my role specifically, I liaise with governments and multilateral organizations, NGOs, civil society groups. And the idea is to disseminate our findings, identify key synergies, and really help inform evidence-based policymaking and encourage further and targeted action from pharmaceutical companies to ultimately contribute to achieving these global health goals. At the Access to Medicine Foundation, we evaluate and rank the 20 biggest pharma companies on their efforts to improve access to innovations in 108 low and middle income countries. So for many years, we have been assessing and tracking performance of these research-based pharma companies in their efforts to expand access to products and looking at where they're developing new products and addressing R&D priorities, and really meeting the needs of the most vulnerable populations. And this certainly includes women and girls in the context of sexual and reproductive health and rights. I should say we're an independent research foundation. We don't receive any funding from the pharmaceutical industry, and we're funded by the Dutch and UK governments, the Bill and Melinda Gates Foundation, Helmsley Charitable Trust, and AXA Investment Managers. We actually recently, at the end of May, just published a new piece that is highlighting what pharmaceutical companies have been doing in terms of sexual and reproductive health rights and their efforts to improve access for people living in low and middle income countries, what was sort of the state of play before the pandemic happened, and where there has been some progress over the past sort of 2.5 years. And you can find that paper on our website at www.accesstomedicinefoundation.org. We will also be publishing a new analysis out in November with the Access to Medicine Index that will really be able to dive even deeper into this issue and really look at some of the key gaps that are remaining. My main key message would be that while we have seen some really strong examples of progress in the past couple of years, we really need more work from all partners and all relevant companies, specifically to help reverse setbacks that have been caused by the pandemic, but also to expand method choice, to continue to improve access, and to really make sure that we're creating an environment that enables people to have ultimately access to the products that they need. Women and girls in low and middle income countries are continuing to lose out when it comes to their rights. And a core problem is really their lack of access to these essential products. So it's really critical that we assess this, that we understand what those gaps are, and that we're able to collectively work to ensure that there's progress being made. We have seen these knock-on effects of COVID-19, and it's already been a challenging situation in terms of access, and that has really, made it worse. We've seen HPV vaccination disruptions. We've seen disruptions with postnatal care and access to family planning services. And so we really want to ensure that this progress that was made before the pandemic is protected, that ultimately we're collectively encouraging and motivating more companies to step up and make really big, broad commitments and follow through on them, and also forge new partnerships, work with local stakeholders to better understand need, and to make sure that they're demonstrating progress on commitments made to date.
Thank you so much, Margo. I'd love to come back to that partnerships point as well as we go through the conversation. Claus, over to you.
Yeah, thank you, Zahid, and a pleasure to be here with you, Margo and Mariarosa. We've set ourselves on a mission. By 2030, as a private sector company, we intend to make sure that 100 million women will get access to contraceptive choices in low and middle income countries, thereby helping the SDGs to be reached by the end of this decade. And it's a huge stretch. You just have to realize what the numbers are. There's more than 200 million women who lack access to contraceptive methods and choices. So imagine a world where we would be successful in fully closing this gap. This would mean, according to some sources, that we would avert up to 76 million unintended pregnancies per year, 46 million induced abortions, and 70,000 maternal deaths annually. I mean, just think about the sheer size of this burden that we have just because there's inequality. And I think the lack of access to contraception is just one strong indicator for gender inequality across the globe. So I would say that we all need to step back from time to time and imagine what it feels for a 12-year-old, 13-year-old living in a low-income country that gets forced into marriage, that starts giving birth at a very young age, that has to quit school, that is not able to live up to its full potential. And that has to be a change that we need to strive for. And that's what I would like to invite the audience to really think about the size of the issue and the collective effort that we need to address it and to step-by-step reduce gender inequality. I think that is something that I want to state towards the very beginning of the session today. So the gap is huge, the challenge is huge, but we have the tools and the means to close the gap if we really want to collectively.
Thank you so much, Claus. And actually, if you're in the audience, please do also share more about where you're dialing in from. Tell us who you are. Share your perspectives as we go through the conversation. I'm going to ask a few questions now to our panel, but feel free for you in the audience to answer those as well. Put your thoughts in and also put in your questions. We'll come to those as we go through. So let's jump into our first question. A number of you, and in my intro, I referenced the pandemic, difficult to avoid that issue, clearly put a lot of pressure on a whole range of systems, not least the issues we're talking about today, interrupting HPV vaccination, postnatal care, access to family planning, and so on. Can you perhaps share your perspectives on what you believe the international community is able to do to reverse these impacts and help women? Perhaps I'll start with you, Margo.
Yeah, thank you. And it's really a great question. I think part of what we were trying to unpack in our recent paper was really, what has been the impact of COVID-19 that we can see as of now. And as I mentioned, in the fall, we'll be launching a full comprehensive analysis on exactly what that impact has been. But we've also seen that there has been a renewed commitment from a lot of global health funders to continue to prioritize sexual and reproductive health rights as a global health priority, and that has been really positive to see. So I think that although there were certainly major setbacks from COVID-19 in terms of access, we have still seen a renewed commitment, and now it's really about making sure that the existing momentum is not lost, and that there can be more progress made, and that there will be more investments to address what Claus was saying. The gap is huge, and to be able to all kind of work together and still keep that focus and still make sure that despite 2.5 years of COVID, that we can still protect the gains that were made before, and that we can think about the future, and we can think about what more can be done, and what other opportunities can be seized upon, and what other gaps can be filled in the future, so that we can narrow down those awful numbers that Claus was mentioning before.
Thank you. Mariarosa, what's your perspectives on that?
Sorry. Well, I think there are a couple of things to take into account here. So what we had seen during the pandemic, if the word during can be used, for example, from the beginning up to 1 year, at least additional 12 million women lost access to family planning, and lost access to services, and lost access to awareness building, support, community education. So that was quite a striking number. UNFPA is a very pragmatic, field-oriented organization. We are present in 150 countries. We have a program which is called UNFPA Supplies that really as the aim and the wish to reach up to the last mile, leaving no woman behind with commodities. So that was our biggest concern, our biggest fear, not to be able to reach that last woman. And of course, when the pandemic began, and it caught us a bit out of guard for that, no? So we immediately had to put in place some measures. And I think, Zahid, one of the key things that worked was actually working, liaising, joining hands from the community level up to the global level with our partners. So we were able at the country level to work directly with our partners, look at the supply chains, and work with governments to prioritize and influence the country programs having sexual and reproductive rights in the forefront. And I think we were very successful on that. And there were a couple of key messages that we kept on bringing to the public attention. And the first one was that in that disruption of health systems, it was not the moment to lower the guard on the importance of investing in sexual and reproductive rights. So that was the first key message that we keep on sending. We keep on sending it also now when we are in a sort of global humanitarian crisis. Lowering investments is not the key. It goes the other way. It won't produce a sustainable future. So that's the first thing. And the second thing, which we really learned in practice, was the importance of bringing together meaningful ecosystems of partners around specific objectives of ensuring sexual and reproductive rights. And I think those were the two, let's say, key messages, and also two key areas of success in really keeping the attention high on this. And maybe we can say more about the importance of the partnerships later, but really, we brought this to the public attention. We kept on saying investing $1 in ensuring sexual and reproductive rights brings $3 back to a society. So every, let's say, the governments can then invest those money in social services, in really empowering societies and making sure that they are prepared when there is another humanitarian crisis.
Thank you, Mariarosa. Yeah, I'm going to come back to you actually on that point around keeping this on the global agenda in just a second. I'd love to explore that further. But before I do that, Claus, any thoughts from you?
I think before we talk about how to improve the situation for many women around the globe, we have to recognize that oftentimes they have been hit particularly hard by the pandemic in many countries. I mean, if you think about it, roughly 75%, if I recall the number correctly, of healthcare frontline workers are women. Yeah, so they have really been key to successfully to help healthcare systems to more or less successfully cope with the situation. Yeah, so at the same time, the healthcare services for women in many countries have been scaled back because emergency modes were switched on and other things were considered to be more important. So we have to help countries to get back on track to put services like sexual and reproductive health services back on the list for women and back into coverage in many places. So I think we forget to recognize the role of women in mastering the crisis. And I mean, 3/4 of healthcare workers are women, frontline workers, but in the C-suite in the healthcare system, you just find a single-digit percentage. It also speaks to an issue in terms of gender equality, inequality in healthcare systems. So, but having said this, I'm still optimistic because there have been a couple of learnings that we have been able to draw from the pandemic. So, and the one that personally also for me was the most striking one was an increase in really deep-rooted and intense partnerships between the public and the private sector. And I think the level of trust has ever grown since the outbreak of the pandemic, because it worked in many ways and in many places. And I think it has lifted us on a better basis to tackling future healthcare issues. So as a private company sector, we've spelled out the vision, health for all, hunger for none. And I think in this crisis, I think both components like nutrition and health have been, let's say, perceived as being so vital to humankind. So we are in the areas that are relevant to the people on this planet. We also have stepped up as a private sector partner, as many others, with giving donations, with providing products, with helping with logistics around the globe, also supporting UNFPA in many ways. And it's encouraging to see that despite some governments scaling back their support for sexual and reproductive health services, there are others compensating for it. So Margo mentioned a few. I mean, the Canadian government has made a few steps together with UNICEF and Nutrition International, where they also not only but also help with sexual and reproductive health services in some geographies. Sweden has an agreement with the Clinton Health Access Initiative. France has increased its funding. Germany is pretty active. So these are all, let's say, ingredients for a future solution that make me optimistic that through an increased collaboration and deeper partnerships, we can still achieve the 2030 SDG goals.
Great, thank you, Claus. So I was going to ask you all, as I remarked in my opening, I worry there's been a sort of almost a crowding out. You know, the various crises we're dealing with, of course, you add into that conflict and climate change, a crowding out of these issues. But the way you've been describing it to me now sounds quite optimistic, that in a sense, we've actually learned a lot from the pandemic around how to use our voice, how to step into these issues, innovate and partner. Is it so? Actually, I'm interested to understand, in terms of the position of this issue on the global agenda. Do you feel that we've been successful through the pandemic and now to keep it top of mind, or is there more that we can do to push it further up the agenda and back onto policymakers' agendas? Perhaps I could ask Margo, you've got a good overview of this from your network. Where are you seeing the need in terms of just putting this or keeping it on the agenda?
I think it's incredibly important to sort of take stock of some of the lessons learned from COVID. And I think one of those was certainly that if you try to address a crisis in the middle of it, you don't get very far. And I think a lot of different global health funders, as I mentioned, had previously been supporting SHRH and kind of realized that they needed to continue to do that, and that if they wanted to have a strong return on their investments, stopping in the middle of a pandemic and pivoting was not going to, help achieve those goals. So I think there has been a lot of learning from COVID-19, and there has been this emphasis on making sure that people do have access to the products that they need. And I think there's a better understanding of what that means, because people, were not able to access vaccines even in high-income countries in the beginning of the pandemic, and still in many places now. So I think when you apply that to the context of SHRH and access to contraceptives and all of the products that are necessary for saving lives with women giving birth, and also making sure that you're preventing unwanted pregnancies and everything in between, and STIs and so many different things that fall under the context of sexual and reproductive health rights. So I think governments have been keen to keep those priorities in many cases, and Claus mentioned quite a few examples, and I would also add the UK and the Netherlands to that mix as well. And I think it is just a matter of continuously demonstrating the return on investment, as Mariarosa mentioned as well, and understanding that, you need to keep moving, and you need to keep exploring new partnerships, and you need to keep evaluating what more companies can be doing, and what sort of efforts within the pandemic were successful in improving access, and what could be applied to this case, and what are the lessons learned that could be applied to SHRH. And I think one of the things that we look at in the context of the Access to Medicine Index is access planning. So making sure that when there's a new project in the pipeline, you're thinking as a company really early on, how are you going to make this available and affordable in LMIC settings? Are you going to register it in different countries? Are you going to do a non-exclusive voluntary license? There's a lot of different mechanisms that can be used, and being able to sort of highlight the importance of that and understand why that's relevant, I think is really important. And when you have these partnerships and when you have this renewed emphasis on making sure that we keep that progress, access plans can be a really nice element of, let's think about the future. How can we keep this moving along? How can we keep learning from different experiences and propelling access further and faster, and making sure that people are getting access to the products they need as soon as they're launched, instead of 5-10 years down the road. And I think that was a big learning from COVID as well. People need access immediately, not in this sort of tiered approach. Great,
thank you for that. I'd like to dig in, actually looking ahead in a sense at two of the lessons that have struck me from the pandemic. One is partnerships that a number of you have mentioned already, and the other is the idea of innovation and technology. I think it was quite incredible to see how fast people innovated in the face of the pandemic, and how we can bring that same spirit to this issue. So perhaps let's start with that one, innovation technology. Claus, maybe you could say a bit more about how you see innovation technology playing a role in tackling these issues.
I think it's fair to say that the pandemic has shown that digital is here to stay, and to me, it's an invitation for us to use it as an additional means to reach more women with information, with delivery of information, with information on where to find the next healthcare institution that they may need. But I also think that we need to make sure that we preserve a high standard with new digital pathways and methods. We have a long catalog of high impact procedures in the area of family planning, and we see the high potential with digital opportunities and digital tools, but we still need to make sure that they deliver to the highest standard, A, and B, that we can really measure the impact. So it's not just about reaching millions of users, potential users of contraceptive methods. It's also helping them to find the support they need with nurses, with midwives, with gynecologists, etc., etc. So we are experimenting a lot with different digital offerings and information campaigns. So we have the Your Life campaign. It's a big campaign, also in collaboration with many partners, that really reach millions of women in low and middle income countries with information on sexual and reproductive health and health services. We have other projects, for example, in Kenya. One is called Yangu, where we not only bring across information, but where we also help with geo-tracking, in a sense that women can locate the closest facility where they can find sexual and reproductive health services should they need them. And I think that also is what we need to do. When I look at the questions that come in from the audience here, there is a question: how can we go about to increase uptake of contraceptives among teenagers and LMICs with high teenage pregnancy index? I think these new media, these new channels will be key, but we have to get it right. And the issue always is how to scale good ideas up. So we need to help those who develop digital solutions and who may not have the full set of capabilities to scale them up, to support them with coaching, with access to financing. I think Mariarosa, you can speak to it particularly well with the activities that the UNFPA is unfolding in this area. So you have platforms where you help young startups and others to scale up their solutions. I think there's an endless range of opportunities. Teenagers use chatbots. They are into gaming. So I think it's a big invitation for us to be creative, to collaborate, to find the right digital solutions to scale them up to reach even more women and especially teenagers in low and middle income countries. I think it's a big, big opportunity for us.
Thank you so much. The other piece that's come out strongly in this conversation so far is around partnerships. I think it's another interesting thing we've all learned how to do better and faster. Actually, Mariarosa, you talked about some of these partnerships in your remarks. Perhaps you could say a bit more about how partnerships fit into the way you work as an organisation, in terms of how you engage with business and others who might be listening on this call.
Yes, absolutely. Can I just add one little piece to what Claus was mentioning? Sure. Around innovation, also because that's one of the key lessons learned after the pandemic, but also now in the humanitarian crisis. So really the importance of supporting meaningfully youth-led and women-led organizations from communities. So who develop innovative solutions, who have their small and medium enterprises working, producing services for SHRH. I mean, a lot has been said about this. We always speak about these community movements. I think what we need to put together is really a network of support. There is really a lot going on in terms of innovative solutions, in terms of production. I'm thinking about, for example, the programs we have in some countries around menstrual health, women-led small and medium enterprises working on that, not only producing, but also building awareness in communities. And I saw there was a question around building awareness of men and boys. Yes, also doing that because they are part of the solution and we can't reach the solution without having them fully on board. So again, in an element of a successful partnership, and not only for innovation, the key central role of community groups and community small and medium enterprises, particularly if led by women and youth. So that's an element, Zahid, of what we see now as a successful partnership. Overall, if you ask me, we have a strategy around engaging with the private sector. I would say private strategic partners. So it also includes philanthropies, foundations, of course, the corporate sector, civil society. But again, the shift is really thinking through ecosystems. So thinking through platforms of partners that are complementary and have complementary roles and responsibilities. I always say that the bad partnership is where everyone does everything and you have like wishy-washy situations that don't go anywhere. I think what particularly the pandemic has taught us in terms of being pragmatic on partnerships is really having these red thread partnerships where you have platforms with complementarity. So that's the first thing. The other very important thing to take into account, and I think all of us, on the one hand, the United Nations, on the other hand, the private sector, have become more mature. We've become more aware of the possibilities of partnerships of our roles, is really the fact that, yes, it's about money, but it's not only about money. There is a financial gap. Yes, we need financial resources. Yes, but this has to be complemented by what we call the reach power of partnerships. So the opportunity really to bring these messages to very broad audiences, audiences of public opinion, audiences of consumers, audiences of supporters. So really the reach power of partnerships and the brain power of partnerships. And here it goes back to, of course, the innovation piece, no? So working together, for example, on the logistics side for leaving no one behind. And that's the last piece of what I wanted to mention for a successful ideal partnership. As part of the Sustainable Development Goals, one of the key pillars is really leaving no one behind. No? So we really need to make sure that we put that in practice. leaving no woman and girl behind. Talking about inclusion and diversity, talking about that in all the operations of our partners. So that's really key.
Great, thank you so much. And it's great to see so many of you online as well, from over 30 countries, I understand. We've got people from France, Brazil, India, Mexico, US, Germany, Canada, Dubai, Zimbabwe, Kenya, Argentina, Ecuador, Pakistan, Indonesia, Paraguay, just to name a few. Please do share your thoughts on innovation, your thoughts on partnership as well. We'd love to use this as an opportunity to get your perspectives as well. And please do share your questions. We've got some great questions already, and I'm going to come to those in a minute. Before I do, I want to ask our panel to ask each other a question. So I'm going to start with Margo. Perhaps you could ask someone on the panel a question.
Thank you, and thank you for the opportunity to ask another panelist a question. I think it's a great idea, and I think it's a really nice part of this conversation. So I would like to take the opportunity to ask Claus, what are some of the opportunities that you think Bayer and other pharmaceutical companies could be taking in the future to continue to improve access to medicine for women and girls in LMICs and with specific regard to improving sexual and reproductive health and rights?
Yeah. So I mean, there's a few things that you can let's say relate to in this regard. So the first one is you should transition in terms of your role as a company, as a private sector company. So you should not just limit yourself to be a pure supplier. Yeah? And it's a transformation for a private sector company to really embed itself in the ecosystem and to find complementary organizations that help to achieve better access. I think, and that's a shift also in the capabilities needed within a company. So this transition in terms of the role that you're playing. Secondly, of course, affordability always is an issue. And as Bayer, many other companies have established tiered pricing models for the commercial sales that they have. That is also a very relevant thing to do, because we shouldn't forget that 52%, I think, of 8 billion people soon to live on this planet lack medical coverage. So any sexual and reproductive health services are an out-of-pocket spend. So, and we should try our best to minimize the extra burden in this regard. And then, as you said, when you think about new contraceptive methods, go into access planning early on. It's probably not the most burning issue at the moment, because we have a broad range of methods available. I think bringing them to patients, having the infrastructure on the ground, having the partners on the ground to really have those products reach the users is probably a way bigger lever. But of course, also we as a women's healthcare company are doing significant research in this area. And we're also looking into new contraceptive methods, and we're investing in this field. And then, of course, the question will be, how do you make sure early on that there's a more simultaneous availability of these offering and these choices around the globe? That's what I would say.
Great, thank you. Great question, great answer. We go to Mariarosa for your question.
Yes. So my question is also for Claus, and this is a conversation that we had, and I think it's very important because I think Bayer sets the example in the private world. So maybe it's interesting for us, for our audience, to know how you are mainstreaming actually women empowerment and sexual reproductive rights in the company. So how is it part of your corporate social responsibility and measurement of that?
Yeah. So we do have a quite ambitious ESG agenda as a company. So of course we have a broad set of environmental targets that we want to achieve. So when it comes to limiting greenhouse gas emissions and avoiding greenhouse gas emissions, in the pharmaceuticals division, we set this goal of making sure that 100 million women are getting access to contraceptive choices by 2030, and there's broader access goals for the rest of the portfolio. We have embedded these goals and the interim milestones to get to the 2030 goal in the remuneration of our leadership, which really anchors it as a strong component of the company strategy. But honestly, it is an incentive for the employees to help us achieve this goal, but most of them are so motivated to help achieving that anyhow, that we get a broad support within the company. So my team and I, we receive a lot of support or offering for help. What else can we do? We have country colleagues from the 130 countries that we're operating in that say, is there anything else we can do on top of it? So it is really a grassroots feeling when you think about it. So everyone is really lining up behind the goal and thinking about how to achieve this. So of course we share the progress. We are being transparent, be it on investments we made in new factories to ensure supply, be it in terms of partnerships we embrace, be it with UNFPA, USAID, or be it with the Challenge Initiative, and we constantly feed back to the organization what the progress is and where we stand to have the transparency, and that really helps in the corporate context.
Thank you both. Such an important question about embedding all of this within business. Thank you so much. So Claus, it's your turn before we go to our audience.
Yeah, so Zahid, it's been great to having you as a moderator, but I would also like to channel a question straight to you, because as the CEO of Business Fights Poverty, you and your organization cover a broad range of very significant aspects that affect our planet, people, and are related to challenging situations. What do you think is the role that innovation can play when it comes to family planning and the future of girls living on this planet? So step out of your shoes as a moderator and share your thoughts with us, please.
Yeah, I don't think you're allowed to ask me a question, but anyway, let me think. So I think innovation for me has probably got a number of aspects. One is, of course, around product and service innovation. And you've talked a bit about that already. And that clearly is something that business is very good at. How do you innovate around new ideas, but also the business model? So we talked about access. Those access challenges are obviously the biggest issues that businesses face. So I think there's an innovation on that side, and we're seeing some really great innovation, including during the pandemic, but also in the context of climate change and other issues that we're facing. But I think the other interesting piece for me, and perhaps the most exciting piece, is innovation around partnerships and how we work together. Mariarosa, you mentioned bringing in voices and local community. For me, creating partnerships where you put voice at the centre, and for us, the organisation, that's something we've set ourselves an ambition for, is thinking about how you can listen to those who are most proximate to the issues and involve them in the solutions. But very often the solutions, most interesting solutions, lie with those who are most proximate to them, to the issues. So I think innovation I would define broadly to be not just about what you make or what you do, but also about how you listen and how you work with others. So yeah, I guess that's how I would respond to your question. Okay, so let's move on to the audience. You've got some great questions. I want to start with the one about men and the role of men. In fact, there's a number in here about that. So Maria has asked, what have been the efforts around sex education for men, programs focused on men? We also had a question from Amama around contraception for men, and the whole role of men has come up, and we do quite a lot of work on gender and women's empowerment, and very often the piece that's not paid enough attention to is the role of men as allies or as part of the solution to these issues. So who'd like to have a go first at that question around men?
I may say, oh, sorry, yeah, go ahead. Great.
Yes, so as the male panelist here, perhaps I can pick it up. looking at it from an R&D perspective, we of course are looking into potential targets, as we state and call them in research, to also find potential ways for male contraception. I mean, that's all I can say at this stage, but we have some excellent researchers, and we're collaborating closely with renowned organizations to really potentially find new contraceptive methods that also have male targets. So that is something which is not left out of focus. That's what I would say.
Great, thank you. And Mariarosa, you were going to jump in there as well.
Yeah, no, I wanted to make a general consideration before we went into the products consideration. So the general consideration is that, as I was saying before, Zahid, men are part of the solution. We cannot be successful if we don't build the awareness, if we don't have men and boys and boys-led organizations as well on our side. And for example, you know, from what apparently is a very simple intervention in a community, like a husbands group, like a boys social and economic group in communities and villages, that actually makes a difference, because it makes not only it's a matter of building knowledge and support, but it also makes girls and women more empowered. Having their complementary side on their side is something that we have seen in terms of impact of our programs, really makes a substantial difference. And then, of course, there's a more general policy and more like at a different level type of awareness building with men around women's empowerment and how to make sure that really there's women equality and women are given a voice. So that's absolutely part of, and of course, this applies also to organizations, to our organization, to the partners where we work. So that's why we look very much, for example, like women's leadership supported by the men's side.
Thank you. Yeah, I mean, from our experience, unless you deal with social norms and power relationships, then often you can't deal with these issues, especially if you've got men making decisions about women. But anyway, so thank you for answering that question. So another question that's come in, which I'd like to turn to is, actually I'd like to put this one to Margo, if I may. It's around promoting awareness of the issues, but also there's a question that's related, which is around tackling misconceptions around some of this. And I guess I would bundle that together as using voice and using as business. Now, how do we as businesses and in partnership with others, how do we shift the debate? How do we put this issue at the top of the agenda? How do we use, I mean, in the case of, say, you know, many companies are very good at marketing and understanding consumers and getting messages across. How do you use that sort of ability to shift consumer behavior into shifting norms and thinking about these sorts of issues? So I'm going to bundle those questions up in that way, if I may. So Margo, if you'd like to respond to that.
I think when we're talking about addressing false beliefs or misconceptions, or even trying to build a level of comfort with taking on a new product as an individual, I think you need to really go back to that conversation about partnerships, and you really need to go back to working with local governments, really understanding the target population, really understanding what their unique needs are. I think choice is an incredibly important element of that, but also, you know, making sure that there is a population who is ready and willing and wants to receive that product. And I think having those conversations and working with local governments and local NGOs and different civil society groups to make sure that that is the case, I think is really important. And that's why we've seen a lot of really positive examples where partnerships have involved local governments, have involved different patient populations, so that it is very clear what is needed in that particular group for those particular people. And that choice element is certainly huge in that. And I think that goes back to the previous question as well. It's also when you're thinking about the role of men and different products that are being developed, access, of course, is huge for that as well, but also making sure that those different individual populations in different places are ready for those products and are willing to take them on and utilize them. And I think, again, partnerships are key for that, and making sure that people are going to want to take these products.
Great, thank you. Anyone else want to jump on the back of that response?
I would just like to pick up another question that I just saw coming in, if I may, Zahid.
You may.
Yeah, because that is really near and dear to my heart. Daniela Munin asked, how can the farm industry help LMICs to obtain the tech needed to manufacture SHRH commodities locally? This would help LMICs to be more self-sufficient, absorb supply chain shocks, such as was experienced during COVID. This is an interesting question, and I think it's been debated heavily in the area of vaccines. The one thing I want to underline is that also we as a company, we did not have any single stock out in this area during the pandemic. So we've been able to maintain the global supply chains, despite the stress that we've seen. So that's one. The second one is a full verticalization will be inefficient. If you think about it, if you invest into a full verticalization of these productions, that's money that's no longer there for innovation. However, I think there is a need to think about broadening, at least to some extent, some of the production offerings. And what we've done as a company last year is we have invested 400 million euros, not just into upgrading an existing family planning plant in Finland, where we are producing these commodities. We've also added a new one in a middle-income country in Middle America, in Costa Rica. So, and that one is purely being built to serve the needs of low and middle-income countries exclusively. It is in a region where also the demand is high, but we will have the opportunity to not just broaden the network, but to really make sure that this goes into low and middle income countries. I think the full verticalization is, if you think it through, it is probably going to be inefficient.
Okay, thank you. Thank you, Klaus. I might just stay with you. Actually, another question is coming from Flynn, which I think speaks, so maybe builds on what you've just been saying, which is around maybe what more your business is doing around innovation, perhaps around other aspects of access to really tackle these issues around access to reproductive and sexual health. So perhaps you could say a bit more about what Bayer's doing to, as the question says here, better meet women's needs and increase access.
Yeah. Well, I mean, on our way, the one component I just touched upon, which was making sure that also of the long run, we have sufficient supply in place to really reach an additional 100 million women. So that's an important one also for our partners, because they want to have a reliable source of product, and not just for the next year and the year after, but for the long run. So that's one. The second one is we will never be able to achieve this alone. As a company, as a single company, we need strong partnerships, mutual trust and recognition for what we can do and what others can do to do it. We have supported an initiative called the Challenge Initiative, which is being run by the Johns Hopkins University with a significant grant of 45 million euros over a certain time span, where we encourage local governments to co-finance local activities in the area of sexual and reproductive health services. So it's really trying to identify promising approaches where also local authorities are ready to co-invest in order to improve the situation. And that is something which is mainly targeted to informal settlements in the ever-growing megacities on this planet. And the third one is that we have expanded our activities in the area of humanitarian crisis. So we are working, for example, with the German Red Cross on sexual and reproductive health services being offered in crisis situation, in geographies where there's civil wars, etc., because their maternal death rates are particularly high. So these are just some activities that we have brought forward to drive the 100 million, the achievement of the 100 million challenge. And then there is way more with the teams that we have on the ground in many geographies, in many countries, where we partner with NGOs, with governments and other supranational institutions such as UNFPA to really drive access, because oftentimes, I mean, they have the local knowledge on how to reach women. They may have access to healthcare workers, to midwives, etc., etc. So because it's so vital to use that expertise to advance.
Great, thank you. Another question has come in, which actually speaks to the point I made in the opening, which is around the fact that, as with many things, this issue affects those who are most vulnerable. And a question has come in from Amrit saying, what is the best way to reach more rural parts of the world that struggle the most with access to family planning options? Perhaps I might come to first Mariarosa and then to you, Margo. Perhaps we could talk a bit about access to people in rural areas. Over to you, Mariarosa.
Yes, well, that's actually a very important question that speaks back to the idea of leaving no one behind, no? So how do we do that in practice? And it's one of the main practical challenges that we have, no? So the way to do that, well, again, it goes back to partnerships. It goes back to innovative solutions, like really, in this case, Zahid, and I very much agree with you that innovation is like, in general, on being innovative with partnerships. Here, I'm talking really about technical innovative solutions. And those are the types of brain power partnerships that we try to develop, particularly with the corporate sector, leveraging on logistic capacities, and also, in general, building the capacity of communities. We have this program with another private sector, very prominent partner, to bring maternal health mobile solutions, for example, to very remote areas in Congo-Brazzaville. But, you know, it's not only deploying the solution, it's building the local conducive environment that leads to the possibility of rolling out that solution, which means, again, having the government, it means having the local civil society, it means having the local actors fully involved.
Great.
So, yes,
thank you.
Technical solutions and partnerships.
Thank you. And Margo, your thoughts?
Yeah, first and foremost, I would completely agree with Mariarosa. I think innovation is really important in making sure that there are long-acting contraceptives, devices that enable people to visit clinics less often. When women are living in really rural areas, you know, they may not be able to travel once a month to their primary care physician or to a pharmacy even. So being able to address some of those needs for last mile delivery, I think does really relate to innovation and to access to existing products that are long acting. The same is true also in terms of heat stable products, say for maternal hemorrhage. I think understanding the local context and understanding the local needs, and not just for a country, but for different population groups within a country, is incredibly important. But I would also say that there are supply chain strengthening initiatives that can be really important that are focused on last mile service delivery. Zipline is one example that's been interesting to look at over the years. And just figuring out how to get products to more hard to reach populations is a critical part of access. As I said, it doesn't stop at the country. It really needs to be a focus on individual populations within a country and how do you reach everyone who needs it? Because that's ultimately access. That's the true form of access.
Great, thank you. And I think that's a great note to end on. And unfortunately, it has brought us to the end of our session today. I mean, lots of great points been made, both by our panelists and by you, the audience. But for me, some big points are, the urgency of action, the scale of the issue. Claus, you mentioned that. The need for innovation around the actions, and all of you have given examples. And finally, the role of partnerships, particularly with the whole ecosystem of partners, and thinking about how we can come together. So on that note, I'd like to thank you all as a panel for joining, all of you at home and joining online. And thanks again for being with us today. Goodbye.